Welcome to Schmooze News. You snooze, you lose. I am your host, Schmoes Pose.
Betrayal, anarchy, milk before cereal. This and more on Dippy Duppy News tonight at 12.
Breaking news. Psittacosis in the air. Why should you care? Now, what is psittacosis? Well, it all comes down to this little fiend. Intercellular bacteria, chlamydia psittaci. It affects parrots like this. This. Gonna bite the camera.
And this.
Also affect poultry animals like this. And this. Some wild birds and humans. There are 3 different names for psittacosis. We have avian chlamydiosis, psittacosis, and ornithosis. What are the 3 differences with these names? Avian chlamydiosis, of course, means just birds. It is the same as psittacosis, but they use this one to just refer to any type of bird that is affected by psittaci chlamydia. So any little birds. Psittacosis refers to the same thing as avian chlamydiosis, but refers to affecting both birds and humans. But psittacosis usually refers to just psittacine birds or parrots. And that's where the difference between psittacosis and ornithosis comes in. Ornithosis refers to any bird that is affected by psittaci chlamydia, but is not a parrot. So, a chicken or a little dove. Transmission is mainly by the fecal-oral route or by inhalation. Respiratory and ocular discharge, as well as feces from infected birds, contain elementary bodies that are resistant to drying and can remain infective for several months when protected by organic debris. Arthropod transmission by blood-sucking ectoparasites and vertical transmission through placental contact is possible. Birds transmit psittacosis to humans by means of exposure, include mouth-to-beak contact, do not kiss the bird, handling, fomites, and aerolization of the bacteria from wild birds. When clinical signs of psittacosis appears in birds, they are nonspecific and can include lethargy, anorexia, ruffled feathers, conjunctivitis, ocular or nasal discharge, diarrhea, a drop in egg production, and excretion of green to yellow-green urates. Diagnosis is achieved using serological testing, bacterial culture, or PCR assay. For more information on psittacosis in the veterinary clinic, we have a special guest with our field expert, Pose Schmoes. We'll go to you, Pose. Thank you, Schmoes Pose. Today we are joined by Dr. Shmiana Schmalsh, a DVM. Thank you so much for joining us, Dr. Schmalsh. Of course. So, Dr. Schmalsh, why is having knowledge of psittacosis so important?
Well, the Centers for Disease Control and Prevention in the United States classifies psittacosis as a reportable condition in most states. The disease causes economic loss in many parts of the world. Chlamydial infections have been identified in at least 465 avian species, mainly caged birds, and colonial nesting birds, ratites, raptors, and poultry.
So our feathery pets and our sources of bird meat could be greatly affected.
Exactly.
I see. As an RVT, what would tip me off that the chief complaint might be this disease?
Well, an RVT should consider avian chlamydiosis in any lethargic bird that has non-specific signs of illness, especially if the bird was recently purchased or stressed.
I see. And what would you, as a DVM, need to help you diagnose this disease?
Well, I would require cloacal, choanal, oropharyngeal, conjunctival, or fecal swabs from live birds, or tissues, preferably the liver or spleen, from dead birds. They should be refrigerated and submitted promptly to the laboratory.
Thank you so much, Dr. Schmalsh. Back to you, Schmoes. Well, thank you, Pose. In humans, psittacosis causes influenza-like illness characterized by headaches, fevers, chills, and a cough. A severe headache and gastrointestinal symptoms in the appropriate clinical setting may warrant a workup for psittacosis. The medical doctor should conduct a thorough patient interview asking about occupational history, hobbies, and travel history, as well as maintaining a high index of suspicion. They diagnose psittacosis with serological testing, complement fixation testing, and microimmunofluorescent antibody testing with paired sera. For both birds and humans, psittacosis is usually treated with doxycycline. Human treatment lasts for about 7 to 8 days, whereas birds may need to be treated for 2 to 8 weeks to fully rid of the infection. The bird will need to be isolated for the entire time of treatment and kept stress-free. Then your buddy friend will be back on their feet. Don't fly away now. Next on Schmozy News, Campylobacter jejuni, deadly bacteria, or delicious Jell-O cup. This and more after these messages.